Hi, Dr. Robert Selig, and welcome to this video in which I am going to introduce to the mineral practitioners how to incorporate homeopathy into your practice, especially for the mineral practitioners that were schooled under the direction of Dr. Lawrence Wilson. Now, I'm Dr. Wilson's biggest fan, but I'm also his biggest critic because he single-handedly threw homeopathy under the bus. And I'm thinking, how do we leave out one of the greatest healing modalities that has ever graced this planet, the most gentle, safest way to heal the body using homeopathy? And so in my upcoming healing series, which will be module 1, which will have 10 classes, approximately one class every month, in which we're going to go over how do you become the home prescriber. We're going to learn how to take this kit, which has 36 remedies, and in these 36 remedies, this will cover your garden variety of things that prop up: our lumps, our bumps, our bruises, our sprains, our strains, our whiplash, our sciatica, our bursitis, our urinary tract infections, our fevers, colds and flus, our headaches. So there's going to be a gazillion things that prop up. Perhaps we're bit by a bee, or, we're stung by a bee, bit by a dog. What are we going to do? We're going to be able to treat our patients intelligently as we learn how to utilize this kit in an emergency situation. So perhaps your child ate a peanut or a strawberry, or was stung by a bee. They go into anaphylactic shock. You're freaking out, and so you give them a dose of apis, and as you're driving them to the emergency room, you have administered a dose. By the time you get to the ER, the kid's fine, and so you don't have to go through that. We're going to be cautionary because we don't want to go into anaphylactic shock as you're freaking out and you see the eye is, the face is swelling up, the eyes are closed, we're worrying about the breathing. So that dose of apis will really act for anaphylactic shock if the laws of similar apply. And so this is where we're going to be able to learn and utilize how to deal with emergency situations. And so when that child has that, whatever allergic reaction, whether it's they ate a peanut at a party or they had some strawberry in their cake and they're allergic to strawberries, and they go into that anaphylactic shock, we have to be ready. We have to have the confidence and the ability to prescribe the indicated remedy. And like I said, you're taking them to the emergency room, but you've already administered the dose. When they arrive at the emergency room, you're going to see they don't need it. This is the beautiful genius of homeopathy. Now, whenever we discuss homeopathy, we always have to pay homage to the brilliant Dr. Samuel Hahnemann. So Samuel Hahnemann was a medical doctor who quit practicing medicine because do no harm. But he still had to feed his 11 children. And because he was a trained chemist, a medical doctor, he was a linguistic, could speak 9 different languages. And so he was translating medical texts from all over the world. He came across some writings about malaria and how Peruvian bark has amazing success at treating malaria. And that was very common in that day and time, around the, late 1800s. And so he was looking at what the author was talking about in the treating of malaria with Peruvian bark. And he was saying that, this is coming from a preeminent physiologist, was saying that Peruvian bark had the bitter astringents, which made it successful in treating malaria. However, Hahnemann was, he was thinking there's many herbs that have bitter astringents. So there was something more to the Peruvian bark and its success in treating malaria. So what he did was he got the Peruvian bark. He started to take 2 doses of this herb daily. And after about a couple weeks, he started to get fevers and chills and nausea and vomiting and gas and bloating, sickly, malaise, and just generalized weakness. And so he was saying that this Peruvian bark can treat the sick, but this Peruvian bark can make the healthy sick. So that was the beginning of understanding the laws are similar. And then he had to figure out, how do we take this Peruvian bark to make a minimum dose so when we administer the medicine, you don't get sick, you don't get all the side effects. And that was the really beginnings of homeopathy. Now, Samuel Hahnemann, he was also a 33-degree Freemason. He was a real initiate in the mystery schools of healing. This man was an adept. He was right there with Paracelsus, Hippocrates, Jesus. This was a brilliant man who did more good for the healing of many of our diseases that we see. This statue is in Washington, D.C., and he's the only physician immortalized in bronze in your nation's capital. And this ceremony took place in the 1900s, and it was commissioned by President William McKinley to give the monument to Samuel Hahnemann. Again, the only physician immortalized in bronze in your nation's capital. That alone should exalt our great understanding of how important Samuel Hahnemann was in the healing world. He was treating the presidents, the kings, the queens, the dignitaries. He was dealing with cholera epidemics. This man was brilliant in the healing world. So this is why we have to pay homage to him, because he is the father of homeopathy. Now, in homeopathy, the three pillars of homeopathy is the laws are similar, the minimum dose, the laws of cure. The laws are similar basically is stating the snake that bites you is the same venom that will heal you. And so this is an important concept to understand. In medicine, in today's allopathy, it's using the world of opposites. That's why we have, antidepressants, anti-inflammatories, antibiotics, antipyretics, antihistamines. And we may need the law of opposites in a life or death emergency situation. I get that, but most of the time we can avoid that. So if we can become more competent in learning homeopathy and understanding the guiding principles of homeopathy, the main principles, which is the laws are similar, and that comes back from the Latin phrase similia similibus curantur, that Paracelsus coined that phrase, which is the Latin phrase for like cures like. So Hahnemann wasn't the first to state that. So this is why Hahnemann truly is an alchemist, and homeopathy is a branch of alchemy. Then the other aspect of it is the minimum dose. So when Hahnemann was trying to figure out, how do we take that Peruvian bark and make it into a minimum dose so the patient doesn't get sick or provoke, a bad healing reaction, a toxicology of the poison? So through the minimum dose, this is where we got into how do we potentize a remedy. And potentization is a process of serial dilution, succussion, percussion, of taking the crude dose and breaking it down and freeing the information in that. Perhaps we're talking about the snake venom. The snake that bites you is the same venom that will heal you. Through extracting the minimum dose, what we're doing is we start with that, that venom, that poisonous venom, and through the art of potentization, succussion, percussion, dilution, we're freeing the information from matter. Because eventually we're not working with matter at all. And that's the great, that's always a very difficult concept for most people to grasp. We're dealing with energy, vibration, frequency. We're dealing with information. So in the process of freeing the information through the potentization, it's the information that we care about. Information is always non-physical, but that information needs a physical carrier. That physical carrier can be a milk sugar pellet that you're all familiar with, or it can be an alcohol tincture. So the milk sugar and the alcohol become the bearer of information, the carrier of the information. What we care about is the information. Information always non physical. So if I'm an artist and I have a concept of a picture that I want to paint, in my mind, that painting is invisible to the world. And so it's going to take paint and canvas and the stroke of the brush to bring the invisible, the information, to the visible. And so this is how we're using homeopathy. We're looking for the information contained, whether it's a plant, animal, mineral kingdom, and through the potentization, we free the information. The information we take in that homeopathic milk sugar tablet, it will pass the blood-brain barrier, avoiding the whole digestion process, because we're working with energy, vibration, frequency that will affect consciousness, influencing the vital force to promote a healing reaction. That's the true simplicity and genius of homeopathy. It's working with the vital force. And so we have the laws of similar, the minimum dose, and the laws of cure, one of the most fascinating things to understand. And we'll talk about this shortly and briefly. So in mineral balancing, we're always talking about biochemical individuality. In homeopathy, we're talking about symptom individuality, because two people can get the exact same disease. Perhaps it's bronchitis. They both catch a bronchitis approximately around the same time. And there's symptoms. There are going to be some similar symptoms they have, but then there's going to be unique symptoms to each patient. That's why one patient may get bryonia for the bronchitis, and one patient may get phosphorus for the bronchitis, because we're really profiling the patient through the laws of similar on a mental level, physical level, emotional level, to get that similar remedy using the minimum dose to provoke a healing reaction. So this is some of the simplicity and beauty of homeopathy. So in the laws of similar, like I said, like cures like. So we know arsenic was a very famous poison back in the day. Its nickname was the inheritance powder. If you wanted to take out your spouse, you would use this arsenic poison, because you couldn't taste it, you couldn't smell it, and it would dissolve easily in food and liquids. And then eventually you would start to get nausea, vomiting, diarrhea, weakness, and then eventually the chills, and eventually the collapse and death. And so with the arsenic poisoning, we would see these symptoms mimicked many, many diseases. It could be from cholera, it could be from pneumonia, it could be from the flu, it could be from food poisoning. So perhaps you're on holiday, you're traveling, and you eat at this place, and you get you get a bout of food poisoning. And in your food poisoning, you feel like you're dying, because it's promoting the fears and the phobias. Like you feel just sickly. You start getting intermittent fever. You get nausea and vomiting and diarrhea, and you get these burning pains. And that's one of the keynotes about arsenicum. It has these burning pains. It's got these fears like you're dying. So a dose of arsenic will be beautiful to treat that food poisoning, and you will see remarkable healing cures right in front of your eyes. So that's the laws of similar kind of in action, as I'm kind of simplifying it, but it's a beautiful law to understand. And that's where we're using arsenic when we see it in everyday life, whether it's a food poisoning, or perhaps it's even just someone's going through a panic attack and they feel like they're dying. They got these fears and phobias, because arsenic works by displacing the phosphate. When you kick out the phosphate, that ATP, you're not going to have that ATP, and you're going to feel it in your heart will start beating, to start moving the blood, and you're going to go into, cardiac arrhythmias. You're going to feel your heart is exploding. It's going to promote a lot of fears and phobias. I'm going to die. And so a dose of arsenic can be great for those type of panic attacks. So that's, in a nutshell, the laws are similar. So the minimum dose. So again, when we're making a homeopathic remedy, it can come from anything in this universe, but typically it's coming from the animal kingdom, the plant kingdom, the mineral kingdom. And that's where we're going to do the potentization through serial dilution, succussion, percussion. And that's how we're creating the different potencies of a homeopathic remedy. When we're working with the 6X potencies, that's the tissue salts. The 6X potencies are in this gray zone. It's still going to have some of the crude material. So let's say, for example, we're working with iron phosphate, the tissue salt iron phosphate in a 6x potency. That will have 1 part per million of the actual iron phosphate. So here it's acting like a mineral. And then when we take it, it's going to be immediately absorbed through the mucosal layer, bypassing the whole, digestive process. And so it will be absorbed, even though it's only 1 part per million, but that absorption is amazing because it's getting into the body and it's working its magic from the get-go. Then the other half of the equation, like I said, it's a gray area because it is a mineral, but yet it's still made in true homeopathic fashion through dilution, succussion, percussion. So it's going to have the energy, vibration, frequency of the iron phosphate, and that is where we're getting the homeopathic effect of it. This is why tissue salts are beautiful to know about. We can prescribe tissue salts for the more problematic population of, children that can't swallow pills, babies that can't swallow pills. Perhaps we have a child, we give them zinc, and we're giving them zinc in the crude dose, and that zinc, they get cramping and they get nausea, and then the child never wants to take zinc ever again. We can start with zinc chloride in a 6x potency, and that zinc chloride, I've seen it on many hair tests where I'm working with children on their initial hair test reports. Their zinc is, god awful low, coming in at 6, 7, 8, really low zinc. Just prescribing zinc chloride over the course of some serial hair testing, I've seen that zinc go from a 6 to a 10 without giving zinc in crude dose, only giving zinc in a tissue salt. So so we can use these tissue salts for the elderly, that the elderly population that can't swallow pills or can't take a lot, can't afford a lot. Tissue salts are amazing. What about the pregnant mothers to be? If they start taking a lot of pills, they're going to get nauseous and they're going to want to, puke it up. So we can use tissue salts to address their deficiencies. We can use the tissue salts for their nausea, for whatever symptoms they have. So learning how to use the tissue salts, to me, is one of the most important fundamental aspects to incorporate into a mineral balancing program. We can use the tissue salts, perhaps, if we see a calcium shell or 4 low or a sympathetic dominant pattern, we can design the tissue salts for many patterns on a hair test. So we're going to learn about the tissue salts, and again, time permitting, because I don't know how long it's going to take me to get through these 36 remedies. And we're going to be using the potencies, the medium potencies, 30C and 200C. Remember, when we're dealing with 30C and 200C potencies, we're not working with matter. We're working with the spiritual essence of the matter. So through the laws of similar, we're finding that similar vibration, frequency, energy, whether it's a snake, whether it's a spider, whether it's arsenic, whether it's sodium phosphate, whatever it is, we're finding through the laws of similar. We're giving that remedy in a minimum dose, which is really spiritualized matter. So it's the energy, vibration, frequency that they're taking in. And we're going to learn how to prescribe these remedies. We're not going to get into the higher potencies in my module 1, because we can get into the 1Ms, the 10Ms, the 50Ms, and then there's even the L and M potencies. We're going to leave that aside for now. We're going to be working. Remember, we have 5,000 remedies in homeopathy. So if we can become familiar with how do we use this kit, these 36 remedies, to treat a lot of common symptoms that we see, the acute things that flare up. So if we can start to learn about these remedies, we can keep expanding our knowledge of homeopathy, because homeopathy, there's so many levels to homeopathy, but we got to start somewhere. And I say, start by learning how to use an acute kit. So the laws of cure, one of the most fascinating, interesting laws in all of medicine, because we know healing is never linear, and the laws of cure is going to be more of a zigzag. The goal of the laws of cure is we're looking at, where is the vital force moving? Because our goal is to get it from the more important organs, our brain, our heart, our nervous system, our liver, our kidneys. So we're trying to move the pathology in the higher organs and moving it to the less superficial organs. So as an example, perhaps we have a baby that's born with eczema because the mother was toxic, because the baby is zinc deficient, and there could be a gazillion reasons why the baby is deficient in zinc. Meanwhile, when you're zinc deficient, the acrodermatitis, all the eczemas and skin issues are going to present itself when you're zinc deficiency. And this is a very common phenomenon we see today. So the baby born with the eczemas, basically the medical profession will treat it with suppressive medications, steroid creams and stuff of that nature. And then, they're managing the eczema, with some success and some not so successful. They're going to have flare-ups, when their immune system's under attack. And then they have to give them more steroids and stuff every time the eczema comes back. Then what happens is, as they suppress the eczema, anytime we suppress anything, any discharge, we suppress the mucus discharges, we suppress the fevers, we suppress the sweat, whatever you're suppressing through pharma, drugs, and stuff like that, you're moving it deeper into other organs of more importance. And in medicine, we call this symptom shift, symptom displacement. So that eczema that got suppressed, in the child's, beginning earlier years in life, then all of a sudden, perhaps they enter into a mercury cycle. They turn 7 years old. They go into this mercury cycle for 7 years. And mercury rules the whole respiratory system, the lungs, the sinuses, the ears, the throat, all that type of stuff. And then all of a sudden, they're in this mercury cycle and they develop asthma. And so that asthma comes online, and now we have to treat the asthma. So as we treat the asthma, as we're treating the asthma gets better. We see the great healing reactions. As we control the asthma through homeopathic treatments, through mineral balancing, detoxification. We're bringing up the vital force. We're getting them healthy. We're dealing the more important lung respiratory system. And then all of a sudden, we're treating the asthma. And as the asthma heals, guess what shows its face? The eczema that was never treated earlier in life. And now we have the eczema, and then the parents freak out. And I'm saying that's exactly what we want to happen. That's the laws of cure. So we went from the more important organ to the less important skin organ. Not that the skin's not important, it's just a lesser important when compared to the brain, the heart, the nervous system, the lungs, etc. So now we have to go back and treat the eczema that was never properly treated. It was suppressed. Through the mineral balancing, we're building up the zinc reserves, we're doing the detoxification, the lifestyle modifications, the diet adaptations, triggers that are promoting, certain flare-ups of this or that. So as we're doing all the physical work, we come in with the homeopathic remedies to start treating the skin conditions of the eczema so we can really heal the eczema that was never healed in the beginning. It was just suppressed. So that's really the essence of the laws of cure. And again, it's never linear. So if someone has mental stuff, they have severe depression and OCDs, they can't leave their house, they got manias, schizophrenias, fears and phobias that prevent them from living. As we're treating the mentals and we see that getting better, we see the vital force moving in the right direction, that may flare up an old arthritic condition that was suppressed back in the day. Or perhaps it flares up the intestinal, stuff that was suppressed during the day, or it could be any symptom that was suppressed. So as we see the mentals improving, then they're going to have other things. Then we have to address those layers and work on that. That's why incorporating a mineral balancing program with homeopathy makes perfect sense, because we got to do the physical work, but we're going to have aggravations. We're going to have things that come up, and we got to be equipped to deal with that. So that's what I wanted to talk about today, on how to incorporate homeopathy. And I'm going to teach you in my online healing program coming up, so you can become a proficient home prescriber for the things that we see in daily life. We can use it for the emotional retracing. We can use homeopathy for the aggravations of old infections that flare up. So this is why I'm enticing you to come sign up with me, so we can learn about how to use homeopathy. We're going to go over homeopathic philosophy, the remedies, the kits, the tissue salts. So those are the things I have in store down the line. In the meantime, thank you for watching this video, and I hope to see you in my healing program coming up. Thank you for your time.